Welcome to Spelling Bee Ninja, where education meets curiosity. Each episode, we dive into fascinating topics that ignite the mind and inspire learning. If you're passionate about exploring science and innovation, you're in the right place. Make sure to subscribe for your free dose of knowledge that will empower you and spark your curiosity. Let's embark on this educational journey together. Today, we're exploring the remarkable story of Christiaan Barnard, the pioneering surgeon who made history with the world's first successful human heart transplant. Born in 1922 in Beaufort West, South Africa, Barnard grew up in a family of modest means, the fourth of 6 children. His father served as a minister in the Dutch Reformed Church, while his mother, a dedicated schoolteacher, was determined to provide her children with a solid education despite their financial struggles. It was this nurturing support that fostered Barnard's ambitions and interest in medicine. A significant early influence on his career was the tragic loss of his older brother Abraham to heart disease at just 31 years old. This heartbreaking incident ignited Barnard's passion for heart surgery, shaping his future contributions to the field. After completing his medical degree at the University of Cape Town, where he excelled academically, Barnard began his medical career as a general practitioner. However, his thirst for knowledge led him to the United States, specifically the University of Minnesota, where he learned advanced surgical techniques, including the use of heart-lung bypass machines. These early experiences of hardship and loss infused Barnard with a sense of empathy, determination, and an unwavering resolve to excel in cardiac surgery. Prior to the first heart transplant, heart surgery itself was a challenging and limited field. It was often seen as a risky endeavor due to the heart's complex nature. The development of heart-lung machines in the 1950s enabled surgeons to halt the heart's function temporarily, allowing for more intricate surgical procedures. This innovation was a game changer. However, the notion of transplanting a heart from one individual to another appeared impossible. Surgeons faced significant obstacles, particularly the risk of the body rejecting foreign tissue and the intricate process of reconnecting the heart to the patient's blood vessels. Yet, Barnard remained steadfast in his belief that these challenges could be overcome. He meticulously studied and honed his skills, laying the foundation for what would become a historic moment in medicine. Before embarking on a human heart transplant, Barnard undertook extensive experiments with animals, including over 50 heart transplants on dogs. He and his team focused on developing surgical techniques and managing post-operative care effectively. A vital component of their preparation was the investigation into immunosuppressive drugs to prevent the body's rejection of the transplanted heart. These rigorous preparations were pivotal in crafting a robust procedure, ultimately serving as a model for future surgical innovations. On December 3, 1967, Christiaan Barnard achieved the unimaginable. He performed the world's first successful human heart transplant at Groote Schuur Hospital in Cape Town. The recipient was Louis Washkansky, a 53-year-old man who was suffering from end-stage heart disease. Denise Darval, a 25-year-old woman, tragically lost her life in a car accident, becoming the heart donor. The procedure took approximately 6 hours and involved a dedicated team of 30 medical professionals working collaboratively. Barnard, ever calm and composed, later reflected, "I was prepared for the operation. I was not prepared for the worldwide response." The surgery was a milestone, as Washkansky survived for 18 days post-transplant, ultimately succumbing to pneumonia caused by the immunosuppressant drugs aimed at preventing the rejection of the new heart. Although his survival was brief, this pioneering transplant opened the door for further advancements in cardiovascular medicine. Barnard employed a surgical technique that involved removing the diseased heart and placing the donor heart in its stead, ensuring the donor heart was preserved in a cold solution to maintain its viability during the process. A unique aspect of Barnard's method was the preservation of the donor heart's atria, which sped up the surgery and enhanced its effectiveness. The precision required in suturing the various chambers and blood vessels was extraordinary, showcasing the skill and dedication of the surgical team involved. The groundbreaking approach established the foundation for modern heart transplant procedures. Despite the revolutionary nature of Barnard's work, the main challenge following the transplant was the prevention of the recipient's immune system rejecting the donor heart. He utilized immunosuppressant drugs such as azathioprine and corticosteroids to manage the immune response, but these drugs also brought severe side effects, heightened infection risk, and ultimately contributed to Washkansky's passing. Even in this tragedy, the insights gained were invaluable, paving the way for the development of better immunosuppressive therapies. Today, treatment protocols have evolved significantly, resulting in far improved survival rates for heart transplant patients. Following his initial success, Barnard became an international celebrity, sharing his transformative experiences with audiences worldwide through magazine covers and television interviews. He used his newfound fame to advocate for organ donation and to promote medical research. Some critics described him as controversial, accusing him of using his patient's life as a test case. Nevertheless, Barnard persevered, continuing his work in the ever-evolving field of cardiac surgery. His ongoing commitment led to further groundbreaking cases, such as the second heart transplant performed in January 1968 on Dr. Philip Bleiberg, a 58-year-old dentist. Bleiberg did exceedingly well post-surgery, living for 19 months, a substantial improvement over Washkansky's short survival. His success story became a beacon of hope for transplant candidates around the globe. Barnard's relentless efforts to refine surgical techniques and enhance post-operative care greatly contributed to establishing heart transplantation as a viable treatment option. As Barnard's pioneering work spread worldwide, heart transplant programs emerged in countries such as the United States, France, and the United Kingdom. Surgeons began replicating the groundbreaking procedures, while advancements in immunosuppressive drugs and surgical techniques led to dramatically improved survival rates for patients. Notably, Dr. Norman Shumway, a surgeon at Stanford University, played a critical role in this continued development in the United States, contributing to better outcomes for heart transplant recipients. Today, survival rates have soared above 90% within the first year post-transplant, highlighting the monumental legacy of Barnard's work. Christiaan Barnard's impact on the field of surgery remains profound, as he reshaped the possibilities of cardiac care and inspired a generation of surgeons to challenge the limits of medical science. He continued to be passionate about organ donation and quality patient care until his passing in 2001 at the age of 78. His legacy serves as a constant reminder of the resilience and determination required to effect revolutionary changes in medicine. Barnard's story encourages aspiring surgeons and researchers to chase innovation in their fields, striving for better treatments for all human ailments. To recap, the journey of Christiaan Barnard and the historic first human heart transplant serves as an inspiring tale of perseverance, innovation, and commitment to bettering lives through medicine. Through significant preparation, meticulous surgical techniques, and addressing challenges head-on, Barnard proved not only that heart transplantation was possible but that it could transform the future of cardiac care. His contributions to the field continue to resonate, encouraging future generations of healthcare professionals to push the boundaries of what is possible. Thank you for joining us today on this incredible journey through medical history. If you enjoyed learning about Christiaan Barnard and the first human heart transplant, be sure to subscribe for more captivating stories from the world of science. Together, we can explore, learn, and inspire one another, one episode at a time. Until next time, keep your curiosity alive and continue your quest for knowledge.